issue for us that the hotel quarantine system is working extremely well. There are also 3 cases that we, as a matter of giving public health notices yesterday, talked about. There's the gentleman who was driving the airport van from Sydney Ground Transport, and of course he's driving airport airline crews back and forth. And then there were 2 other people, a lady in her 60s and a gentleman in their 70s, in his 70s, from the Northern Beaches. So those cases, of course, are now included in today's figures. What we also have had to announce this morning as a result of further work by our incredible tracing team here in New South Wales is that there are other cases. This morning we have announced earlier 2 cases. One of those cases was I think a woman in her 50s, and she is a worker at an aged care facility. That aged care facility is the Pittwater Palms at Avalon. And we also announced this morning that there was a gentleman in his 60s who we have not announced, but I am now announcing that he lives at French's Forest. So it's obviously further down the Northern Beaches Peninsula, on the southern end of the peninsula. He has tested positive and been advised today that he has tested positive, and of course is now doing the 14 days self-isolation. In addition, beyond what we announced this morning, it would appear that there is now also a further case, which is a partner of the lady in her 50s. So they reside together. I understand initial information is that's also in the Palm Beach area. The gentleman from French's Forest has, I've got to say, the New South Wales tracing and tracking of our health teams is just incredible. Just in this last few hours, they've taken histories and managed to work out that this particular person has been working in a band. Interestingly, the band is called Nothing Too Serious, so that's certainly, from our point of view, I wouldn't say it's exactly how we feel, because it obviously is serious, but we are making every effort to do what New South Wales does extremely well, and that is to keep it all in perspective and just deal with what is coming our way at the moment. He has travelled extensively, and I'll ask Dr. Chant in a moment. He's worked at everywhere from Penrith RSL to Avalon RSL and other places, including I think the Kirribilli Club, but I'll leave that to her to go through some of that information. I think that it's fair to say that the New South Wales Health has already worked out some connectedness, which I'll leave Dr. Chant to talk about. And I want to thank again our gold standard tracing team for the work they've done. I think that we are moving very fast to establish all the various locations and connections, and have already worked out connections between the various people that we know have it. There are still issues to be sorted, but I expect that they will be sorted. And I'll ask Dr. Chant now to perhaps give us some more information and detail on these latest cases. Dr. Chant.
Thank you, Minister. So in terms of the messages that I need to get out to the public, we are asking people that have been at the following venues to test and isolate immediately, and we will recontact you with particular advice. The Avalon RSL Club on the 11th of December, all day till closed. It is critical that anyone who is at that RSL club gets tested. Our working hypothesis is that someone at that RSL club was potentially the source of infection for a number of subsequent cases. So it is critical that we identify any individuals that may be positive there. The Penrith RSL Club on the 13th of December from 1 p.m. to 6 p.m. and the Kirribilli Club on the 14th of December from 12 to 3 p.m. So as the Minister has said, We yesterday had the lady in her 60s, the residential worker at the residential village in has crossed over with her at the bowling club on Sunday. So that's the link between those, and we did announce that as a venue of concern yesterday. And clearly her partner is also positive, and obviously we're just exploring whether he also was present at the bowling club on that day, or whether there is transmission in the household or another source of infection for him. In relation to the drummer that the Minister referred to, the gentleman in his 60s, he also was at the Avalon RSL Club on the 11th performing. And obviously our 65-year-old lady was also there. At the moment, we are really still unclear about exact source of the infection, and we are awaiting the genome sequencing. Those results will be available by around 7 p.m. tonight, and I've confirmed with the lab that the sequencing is progressing. So at the moment, the lab worked throughout the night to purify and do all the processes they need, and the machine is due to ping at 5:21 p.m. and then it does take them some time to then interpret the sequence data. So I just want to also just stress my great appreciation and gratitude to the lab, and tell them that they'll also be having a very busy night tonight, as they're now preparing the samples that have been queried there urgently from all of these cases to confirm the epidemiological data to hand that these cases are linked. In relation to the lady in her 60s from notified yesterday, I can confirm that testing on the family-like contacts have all returned negative results, although for precaution we are re-swabbing one of the close contacts for absolute caution. So at this point, my message is thank you very much to the people of the Northern Beaches for coming forward for testing. Please keep yourself tuned to our website and to the media for alerts as we progressively interview cases and people may remember new sites that they've visited. We will be continuing throughout the day to update that information, but I really want to acknowledge and thank the community for the turnout for testing and their cooperation with investigations to date.
Can I just add, this morning I've asked New South Wales Health to ensure that we have additional pop-up centres on the Northern Beaches. And I know I was getting reports as early as about 9 o'clock this morning that there were hundreds of people lining up at the Northern Beaches Hospital. So that's a positive. I want to thank the local community. They're part of my community, and I just want to say thank you to all of you for coming out and doing what we know is the right thing to do, and that is get tested and do it as quickly as possible. Any symptoms at all, as we've said many times, of cough, cold, flu, even fatigue. We've had people who've confirmed that simple fatigue was all they felt. So you do need to get along and get tested. So I'm hoping that Northern Beaches shows New South Wales how to do the testing and come out in great numbers to be tested. And the centres that are now available, as at this morning, the Avalon Recreation Centre, which is down at 59 Old Barrenjoey Road, Avalon, has been set up to operate today from midday, but thereafter from 8 a.m. to 10 p.m. We've got a Newport pop-up as well, the Newport Community Centre, and that's well known to the locals. It'll be open today from 2 p.m. and then again 8 a.m. to 10 p.m. for the next number of days. The Warringah Aquatic Centre drive-through at 1 Aquatic Drive, and that one will be open today from 3 p.m. but then after 8 a.m. to 10 p.m. And of course we've got other testing centres, the Mona Vale Hospital site, which everybody on the Northern Beaches would know, the Brookvale Community Health Centre, where I attended just a couple of weeks ago to have a test, and the Northern Beaches Hospital. So they're very obvious ones. But again, my message as a fellow local, but also the Health Minister, is get out and get tested if you've got any symptoms at all. You'll be doing everybody a favour, including yourself.
Dr. Chan, can we just go through
Dr. Chan.
Dr. Chan, just the movements to see if we can get a working hypothesis or understand the working hypothesis.
They're working on that already, James. They're trying to get to the working.
So the band member.
So currently, Look, it's very important that, I think I've said this at all times, we don't speculate, but obviously what we're looking at is the principles of where people were at and what number of people and did their symptoms align with exposure. So we are looking at potential exposure at the Avalon RSL on the 11th, and that's why it's critical that everyone comes forward for testing that was there.
So how many people were there at the RSL?
So at this point, I know that the lady in her 60s was there. Also the gentleman in his 60s from Frenchs Forest that the Minister referred to, and also I believe that the 70-year-old from yesterday was also there, but I just need to double check that. But I believe they were both there at that time.
Just the aged care worker that wasn't there?
No, the aged care worker then crossed over with the lady from yesterday at the bowling club at Avalon on Sunday.
And, sorry, when did the 65-year-old woman and the man in his 70s get tested for coronavirus? Or was it reported initially last night at 6 p.m? When did they get tested?
Look, I'd have to double check that, but I believe that we announced those. I would just have to double check, but they did get tested after some. I'll check that.
They were at Avalon RSL on Friday, and then the bowler on Sunday, which is where the aged care work was also.
They were tested after that point in time.
They went to the bowler, but it's a hypothesis that there was a site of transmission from the household contacts of women in the 65.
No, so the hypothesis is there's an unknown person that was present at the Avalon RSL that was the source of infection, given that we've got 3 people at least that we think. I'll just double check the numbers of exactly who it is and we'll outline that in the media release, media update. But what we're hypothesising is that that's potentially an exposure source.
So there's an unknown source for everyone? Yeah.
Yes, that's then been passed on the infection to others because they were all there at the same time and their symptom onset. Now, as I said, it's very important that we're sharing our thinking with the community and why we're nominating these sites, but we always keep an open mind, and new information will come and we'll have to change it in response to that. But clearly we do urgently want to get anyone who's been at those venues tested and isolated until they've got a negative result, and we'll be in contact with what you do after that.
Is there once and for all, did the couple first reported by New South Wales Health yesterday self-isolate whilst waiting for test results? Because Mark McGowan has referred to media reports today saying that their behaviour was unacceptable. So can you just clarify, did they
look,
or didn't they?
I think I've made a common thing of not commenting on the individual cases. All I can say is that all of the individuals involved in this investigation have been cooperating, and I'd also like to extend my appreciation to the businesses that are also cooperating with all the contact information. I think it also does highlight the importance that, why we want those QR codes. Why, when they're put on the tables in cafes and restaurants and people might not choose to use them, please, this is a wake-up call, because clearly our ability to contact you rapidly and know for certain who's there. Clearly the RSL clubs have very good systems, usually with the licence check-in, which gives us good assurity that we know exactly who's at that club. We're obviously, the genome sequencing will be very critical this evening. Obviously that will tell us, confirm that whether it's an international source, give us some linkage, but we also are looking at matching any contact lists we've got from the previous Novotel worker with any of the contacts that may be coming up in these other lists that we're getting. So we're doing a lot of forensic work behind the scenes, so you'll have to probably bear with us. The teams are working as hard as we can to piece this puzzle together, but clearly the genome sequencing will give us some really clear information tonight.
Is it possible that the virus could have been bubbling along in the community and not been picked up, or is it more likely that we have had a recent sort of introduction source point than it was just kind of kicking along through people and nobody noticed?
So the only other piece of information that gives me some assurance that it's a recent introduction is the fact that the sewage surveillance was negative on the 10th of December. That collects from the northern area of the peninsula. It was negative. it was recollected, and the 24-hour sampling will conclude today, but we will actually expect to find it positive now, but that's to be expected. But on the 10th it was negative. We've obviously got to look at that catchment drains about 70,000 people. So again, it's one piece of the puzzle and piece of information. We are now working with Sydney Water to look at sewage surveillance, particularly in the Frenchs Forest area, and to try and subset the peninsula a little bit into smaller areas.
Throughout the pandemic, we've seen that some outbreaks have gone extremely fast, others have shut down very suddenly, haven't gone too far. We know that some viruses seem to be super spreader category. We've seen it with Crossroads, etc. The fact that this one location has 3 separate people getting infected in that one location one time, does this indicate this is a pretty virulent strain?
Look, I think it's too premature, and it's really not about the virulence of the strain. I think we don't think the strains are any more virulent than each other. What we know is it's about the exposure, the behaviours and the infectivity of the person at the time. So remember, indoor environments are much more risky than outdoor environments. If you've got loud noise and singing and talking loudly, they're risk factors. So we've gained a lot of knowledge about how COVID is transmitted, and it's really a combination of factors. There'll be individual factors which determine your infectiousness, and we've advised around the fact that very young children seem to be less infectious, and that's probably some biological basis for that. But clearly there is variability between people. We've occasionally had people where we're surprised have not spread to others. What's pleasing is some of the household contacts have not come up, but obviously we have to wait for the 14 days to indicate that. But the good news is we've got them before they've become positive, so then we don't have that next ring of infection in the community.
The aged care worker, have they worked any shifts since they've been exposed, and what's their role like?
So we believe that person, can I just stress, that person did not have any symptoms, and that person was tested because of our advice around coming forward for testing if you've been at any of the sites. And remember, for those sites we say, even if you had symptoms or not, get tested. And the reason for that is that if you're in that pre-symptomatic period, we know you can be infectious for 24 to 48 hours before symptoms develop. It gives us that time. So that person potentially did work, and we are working with the residential facility on that, and obviously the residents as well may well have gone to other venues. So I'm aware that some of the residents also get out and about, and that some of them, a small number of them, have also attended some of the other venues at the times where we've got interest. So we're working with that facility.
Dr. Chan, did these two sets of people, I'm not sure if they're couples, but were they seated together at these venues, or were they just at the same venue?
Look, those investigations will, forensic investigations will continue. At the moment, our major focus has been finding out where people have been so we can do those public alerts. But as we get more detailed information, we'll, build up a hypothesis.
Is there any information that they may have been overseas or been in contact with any international travellers?
So that's obviously the source we're trying to find, and we're also trying to look for anyone, particularly, as I said, who's been at that RSL club on that day, to look at whether they've got any links with overseas travel in any form. So our contact tracing team will be making those inquiries as we're ringing through the list to find out.
There's some conjecture up and around Avalon that there could be exemptions that were granted by the New South Wales government to self-isolate in some mansions around Avalon, and these people didn't abide by those directions. Have you got any information to verify that?
So at this point in time, obviously we look at all situations, and we have even those people that have perhaps medical exemptions or for palliative care reasons or other reasons that they're exempt. Those ones are closely monitored and also tested. So we are obviously, as part of a routine investigation, looking at anyone who may have been anywhere in the peninsula that could pose a risk.
You
so
haven't provided any exemptions to the 4 or 5 now that have tested positive, to your knowledge?
No, none of these individuals have been overseas. If that was the case, that would be an easy investigation.
What about any others in the peninsula? Have there been any exemptions similar to what was asked about for other people that may have been at the RSL on last Friday?
So the process is anyone who's granted an exemption has to have particular reasons, extreme reasons for doing that. Clearly, we've assessed the situation as increasing risk overseas with the international increases, and so really the level, our appetite for exemptions has been quite low. But if there are any cases there, they are also followed up and monitored and are required to have the same testing that occurs at day 0 or day 2, depending on their situation, and also at some time between day 10 and day 12. And so that gives us assurance that those individuals have been free of disease at those points.
So has there been any exemptions recently in the area?
I'm not in a position I haven't personally been briefed on all of that, but obviously you'd expect us to do a thorough investigation, and it includes all of those aspects.
There's been a few residents out and about this morning in the northern beaches wearing masks. Would New South Wales Health be looking to make that mandatory for that region?
Look, our advice is, and given we are in an evolving situation in the northern beaches, our health advice stands, and I think I've been reiterating that. Please maintain your social distancing, your hand hygiene. Don't go out and about when you're unwell. And if you're in areas where you can't socially distance, particularly indoors, that you wear a mask.
But would you be urging people in the northern beaches to be wearing masks now, given what's going on?
I would be certainly encouraging people in the northern beaches and urging people in the northern beaches to follow that health advice I've just outlined. And I think that it's fair to say that mask wearing has declined with some level of complacency in the population. And I think this is a wake-up call to urge the community to continue to follow those health advice. But it needs to follow each element of that.
Final question,
Is there any chance that the 4 people that we've already seen test positive are the source of this infection?
No.
So
well, they've got to have acquired it from somewhere.
Yeah.
So they may have, if they're household contacts, they may have infected each other and that sort of thing, but they're not the source of the infection. We need to find the source of the infection. That's why the genome sequencing is going to be so critical. It will help us identify what the nature of the virus is, and whether it is the locally acquired strain, whether it's the strain that's associated with any of the recent transmission events. So it will be a critical piece, and we will be able to update you later this evening.
There's only a couple of days before Christmas, Dr. Charles.
Sorry.
Regarding the genome sequencing itself, is New South Wales Health using the new technology from the Kirby Institute and Garden to do the rapid genome sequencing?
So we are working with our Vitali Centro at ICPMR has been using this technique. I'm advised that this gives more forensic detail, and so it's still very rapid. It still, regardless, does take, even though the issue of the 4 hours, it still requires preparation, and that's what actually takes some additional time. So the sequencing, the preparation occurred yesterday afternoon and into the morning. It was then run, and the sequencing data will be available at 5:21, and then they'll need to interpret it. So I'm confident that we've got that, but obviously we work, and the reason we want to embrace if we can do it in quicker, faster ways. But we're very pleased with the service that we've had from our public health laboratory.
Minister, there were reports this morning that in some newspapers that the couple, the initial couple yesterday from Avalon had tested and then continued to go out, broken that rule. I know you won't want to comment specifically to that, but do you want to remind people about what the rules are and what should happen in those processes?
Look, what I would say is that, listening to the questioning this morning or this afternoon, everybody would like answers, and I share that. We obviously share that, but you have to understand that we are in a worldwide pandemic. There are 3,000 people a day dying in the US, and we have got effectively heroes. These people who have come forward as heroes to put themselves there and to be tested, and now they're doing what they need to do. I want to thank them because, we should do everything we can, both as a government but also in the media, the media should be doing what they can to support people who have come forward to be tested. Many people, as I've said, might only have fatigue, they might only have a bit of an itchy throat, but they're coming forward, and that's fantastic. So every single one of these people who come forward in the last 48 hours are effectively heroes. They're champions on our behalf, because they are actually going and being tested, and we should be thanking them. We certainly shouldn't be doing anything to ostracise them. So I want to just make sure that the media, and certainly from my point of view, I want to thank them all. Can I say, in terms of people's individual cases, I wouldn't comment, because we need people to actually come forward and know that as far as possible, I mean, there will be cases from time to time where the circumstances will make it a lot more difficult to maintain their privacy. But in general, it's privacy. It's a bit like going to your own doctor and expecting that they would be, whatever they tell you to take your medication, you should. Sometimes you might not do it as well as you should, but they're all trying and they're doing their best.
How important is it on that to make...
Sorry, I'll come to you. Sheila Jones started first, yeah.
Yeah, so it's a couple of days before Christmas. Hundreds of people have been told...
8 days, isn't it? I haven't done it Christmas. Yeah, I think that's right. 8 days.
8 days. About a handful of days. Almost a week. We're just
Thank you.
before Christmas, right? Hundreds of people have been told to self-isolate.
Yep.
How important is it for those people to do what you're doing and suggesting, and be heroes and self-isolate and maintain vigilance so that we can nip this in the bud? I think, as Dr. Chand has said many times, we're certainly asking people to not be complacent. I think actually, in a sense, the last couple of days has been a very telling reminder that we are living in the middle of a pandemic. Certainly I've been out and about the last couple of weeks, and I've seen people everywhere, far more complacent than I've seen them since literally January this year. So in a sense, this is a reminder to us. It's some sort of force giving a reminder to all of us that we're in the middle of a pandemic. You can't afford to forget the messages that Dr. Chant and her team have given us, and that is social distance, wash your hands. If you feel sick, any symptoms at all, even a bit of fatigue, go and get tested. And as Christmas, I know Christmas has challenges, obviously, for all of us, because we're going to be sharing with our family. But some of our families are the most vulnerable, particularly those older people and those people who have some other illnesses, comorbidities. And my message to younger people particularly is, you're not immune from this just because we're talking about some older people at the moment. Who knows where they got it from? It may have come from a younger person. So we need to be very, very serious about making sure that we're all on high alert. Ursula, sorry.
Sorry, just to return to the borders, have you spoken to your colleagues in other states? Are they getting anxious? What's happening?
They're taking an interest, but I've spoken to, I think, 3 ministers today just to make sure that, as I always do, that we're keeping them fully informed. And certainly from New South Wales perspective, I would say that let's not forget New South Wales takes somewhere between 3 and sometimes up to closer to 5,000 people a week. Most of the other states and territories are taking mere hundreds, and sometimes even less than that. So we're taking around about all the people we've had in our hotel quarantine system. Of all of them, there's about 45% that have come from other states and territories. So in effect, we're doing the job that we would hope that everybody understands. We have an incredible health system. We have incredible people like Dr. Chant and her team, who are seriously, they are the top guns in health in Australia. And they are doing the tracing, and I'm quite sure that they will take out this virus as soon as we can do it by cutting off the chain of transmission. That was the last question? Sorry, one more for me, Christopher, and then if you...
Minister, can I ask you then?
Yeah.
We were talking about close contacts. They must stay isolated 14 days. To James's point, 8 days to
follow the instructions.
Is there a chance that you will allow some people potentially, as the information progresses, to go and see their families on Christmas Day?
Look, there's no question that as the information, you're actually getting the information very quickly. If we had a choice, we would have preferred to have got a lot more information together before we came and discussed it with the public. But we have to share this with our community, because they are, as I said before, they're the heroes at the front line. They're the ones who can go and do what we've asked them to do. But of course, as in the previous public announcements, when it's early on in any issue, when more information becomes available, if we can pull back some of that information, we will. And we certainly would with Christmas coming up. But look, that's all we can really say for now, and we'll give any more information that we get during the course of the day by way of a release. If we do need to come back to you, of course we will. Thank you very much. That's it.
Western Australia's Premier Mark McGowan has said that he won't hesitate to put hard border back
I think
up.
I've already answered that question, but thank you very much,
If
everybody.
I could quickly, in regards to this couple and the question of whether they did or did not isolate, during the peak of the pandemic, we would get daily...
Sorry,
updates
I've answered every question,
I
and
just
I
want to
think...
clarify the privacy around this. We would get daily updates from police on people who breached various public health orders, whether they would be told to isolate after a test and then went on to not do that. If this couple has breached a public health order and if that has led to them transmitting it to other people within the community, why is there privacy around that?
Because at the moment we don't know those answers and you're making presumptions. We're not going to make presumptions. And in fact, the primary purpose here, and look, we've been talking to this many of you in this room have been to probably hundreds of press conferences now, and you've heard me say, and Dr. Chant say, right from back in March and February, we need to respect people's privacy as far as is possible so that they can actually feel confident in coming forward. And look, there have been circumstances. I hope, in fact, I wish I hadn't actually named that band now, because some of you will be rushing out. I want to go and hear that band when they're all well, all right, because they're a good band. But I think that it's they just need to respect their privacy as far as is humanly possible. Thank you very much. Thank you. Thank you.